Hello everyone, my name is Greg Short and I am the president of ClinicalHQ, a healthcare technology company based out of Austin, Texas. As we all know, 2020 has been a crazy year for the healthcare industry and especially for home healthcare. PDGM kicked off in January and before anyone really had a chance to fully absorb how that was impacting the business, the coronavirus pandemic emerged and it simultaneously strained our resources relating to helping people who had COVID or needed care in that area, while decimating a wide range of work in the post-acute setting as a result of shelter-in-place policies that eliminated and suspended elective surgeries and rehab. Like many other industries, this has forced healthcare providers to reassess their operational capabilities and search for ways they can handle pandemic and emergency conditions more effectively in the future. And this is particularly relevant for home health providers who, by the nature of their work, are often in the front line for delivering services, irrespective of how challenging those conditions might be. Whether it's a natural disaster like the California wildfires or Hurricane Katrina, or whether it's civil unrest or protests that are blocking streets or access, or a contagion pandemic like coronavirus, people still need care, and providers need to be able to facilitate that care. So today, we're going to explore some of the key operational activities that we have been working on to transform healthcare here at ClinicalHQ over the last few years and show you some live demonstrations of how some of these solutions might be used in your organization in a COVID or post-COVID environment. And specifically, we're going to review 4 key areas. That's centralized communication, contact reduction, risk management, and training. As many of us have experienced in the last few months, communication is something we often take for granted. How we distribute and receive information with our staff, our referral partners, and our patients has often relied on access to those individuals in real time. And whether that's visiting an office or their home or by dropping in to see them randomly, it's still required that I can actually get to that individual. And as we've now all experienced, especially during a pandemic or emergency situation, that can be very challenging. And in those situations, people are craving information. So not only is it hard to get to them, but I need to get to them because they need facts. And they need those facts to be current so that they have the right information for themselves and to provide that to others. And this is where a centralized communication and resource system can really shine. And at ClinicalHQ, we call this Connect. Connect is a secure, cloud-based system that enables your workforce to have access to all the information that they need, both for themselves, for their colleagues, for their patients, and it's all in one location that they can use from any web-enabled device, whether it's a phone, a PC, a tablet, or a laptop. And Connect is really the heart of the services of what we've built at ClinicalHQ. It's the central portal that most of our services operate through, and we made it that way intentionally because information flow is really at the heart of operations in the healthcare industry. So let's look at a specific example of how you could use it right now during the COVID pandemic. The page you're seeing here is the central area of the platform, which we call the resources area. And our resources system can support a number of different information types. Those could be links, PDF files, tables, images, and even digital forms, and we'll get to those in a moment. Now, every client has a private secured repository for their own resources. They can upload their own documents into Connect, but they can also access over 400 resources that ClinicalHQ provides out of the box. So running through a scenario, let's think about our employees. Maybe we have a significant number of workers who used to be in the office and now they're working from home. Our admin staff, back office staff, maybe some of our sales marketers. And it's important in this situation to have a work from home policy so that everyone understands the current expectations from leadership. See here that there is a company work from home policy that has been sent out previously. And when I click on it here, I can see that this was provided back in May. And so if at any time I have questions on this, I can simply come back and view that and I can see what the information was if I have a question about a particular detail. So how do I ensure that my employees have the latest version of that policy over time? Obviously things have been changing quickly with the coronavirus. So it's pretty easy. All I have to do is edit the document here and I can choose a new file and upload it. I can then determine who should have access to that resource, whether that's a specific individual or a specific discipline or the entire organization, which is what we'll pick here. And those groups, by the way, are completely customizable, so you can make them be whatever you need that matches the needs of your business. Now, because this is an important policy update, we're going to notify our staff of this. And when I check this box here and then I submit it, this will automatically send a text message to any staff member who has their cell phone verified, along with an email if that they've got registered for their account. So if you have some workers who maybe are a little bit harder to get, you want to make sure that they received it. This is a great way, especially with the text messages, to make sure that they've received it. And you can actually view reports that will show you who has and hasn't read each of these documents if you ever need to go back and double check, who's sort of following your policies and who isn't. Now, the important thing here is that the resource, when it was updated, simultaneously removed the old one. So there's no way for them to reference the May document now. They've only got the June document. And this is a great way to provide policy updates, documentation updates, forms, anything that you want to ensure that people are always using the latest information. So this type of system is a huge efficiency and quality builder. Workers can rely on always having the latest resources and facts, and they know that they aren't using something that's out of date and going to lead to an incomplete file or a rework or some sort of risk to themselves or the patient. This becomes even more important when we're dealing with a pandemic or an emergency, because we might need to get critical information out to our patients. And so how do we do that effectively? Well, the first thing we can do is we can search for a resource. So I can simply type in something like COVID. I can see all the COVID resources, and I can share these simply with the click of a button. But sharing things one thing at a time isn't always efficient, and we're all about efficiency here at ClinicalHQ. And so your administrators can make packets of grouped resources for sharing. And in fact, as an individual person, you can make packets for yourself as well. And so you can see here, I've already got a COVID packet available that I could send out to any new patient or any patient who's concerned about COVID. And if I edit that, I can see what it contains. And there's obviously links here to things like the CDC guidelines, as well as the virus itself. And those are all super handy. And these are all tied back to that core resource system. So if I update one of those resources with a new version, it will automatically update in the packet, which means that you never have to worry about there being a disconnect around these bundles of information that you're sharing. So let's go and say, we want to add something to the packet. It's really easy. I can simply, click here and search for, say, a mask. Click that and add the mask in. So very easy to add, change, edit these packets. And you can see here that there's a lot of different options as to what you could do. These are useful whether you're, doing sort of COVID related or emergency bundles of information that need to go out to people, but they could also in the future be used for things like start of care or marketing material packages. So there's really no limit to it other than your imagination on how you structure these. Now, another important thing your workers may need during a pandemic is closer to sort of real-time information. Maybe they can't get to a support resource who they would normally call for things. So, whether that's a list of contacts because they need a phone number for somebody, or whether it's a set of coding questions that they might have, we have solutions for those. And generally, we use those in Connect through a system called Smart Tables. So, for example, here, if I go in and I bring up my ICD code table, and I can rapidly search through the thousands of codes to find the potential code that I would need without having to go in and call into the office. And obviously, the office may not even be staffed during an emergency. And these technologies become really even more important the more distributed your workforce is. Whether you have multiple offices all over the state or whether you're a national provider with employees or contractors that might even be working in rural areas that never even get to a home office that frequently, our system gives everyone all the access to the same resources, the same communication capabilities, and really helps you to have a much closer connection and provide much better support to your employees. Now, another added benefit to our platform is how it enables contact reduction, which is really the second aspect of today's presentation. Now, during a pandemic or an emergency, contact reduction is going to manifest in any number of different ways. It might be something that's regulatory, such as social distancing or shelter in place. It may be a physical component, such as just simply having no contact with reusing pens or papers or binders or having to disinfect things. And as a digital cloud-based solution, Connect really enables you to do a lot of those interactions without using paper or binders or pens. The whole goal is to get people using things online. And these can obviously be managed in mind with any other type of regulatory requirement. So if you still need to have certain things that are paper, you can certainly enable that by giving your people a portable printer or enabling them to be able to send those documents directly to the patient to print out on their own printer at home. And so it's a great way that you can reduce contact by having to not have your people who are out in the field, whether they're sales or therapy or clinical, with massive binders of information. They have everything really in this digital briefcase. It's in the palm of their hand and they can access. But perhaps our most powerful aspect of the platform in this regard is our product, which we call Swift. Swift is our digital forms and workflows product. It also supports remote signature capture, which is really, a great way to reduce contact when you need to be getting people to fill out forms and sign paperwork, which is a critical aspect of our business. Now, using Swift, we can convert any paper-based form or process into a secure digital format, and it's much more than what you would get from using one of the more traditional electronic signatures. So let's assume that I have a Spanish-speaking patient who requires a nom-noc to be generated so we can get them wrapped up. Now, I don't speak Spanish, but I can access a Spanish workflow here. So I can quickly put in, pretend I'm the patient. I'll put in my email address, the services that are ending, the date, obviously our QIO details, and some of these things can be pre-populated for your staff if they're common and they're not going to change, so that they don't have to type them in each time. And now I'm going to submit the form, and you can see now that it's being validated. We encrypt all of the data, and then it's sent up to the server for processing. Now, this is a form which could be generated in real time by a clinician in the field or by a support staff, whether they're working from home during a lockdown or whether they're in the office on a regular day. Anyone who you individually grant access to that form can trigger and activate the workflow. And so now I'm logged in back into my portal here. I can see that I've got a form. It's with Greg. Greg has to sign it. I can resend that to them if I've been waiting and I haven't heard from them in a while. It will automatically trigger reminders for them if they haven't filled it out in a while. So that process is being managed for you without your people having to necessarily sit there and micromanage waiting for documents to come back in. And I can see now, I just got in my email box an email with a link and instructions on. I'm just going to click on that here. And now you'll see here that it's taken me to the signing form, which is a fully CMS formatted document in Spanish. You can see that all of the fields have been completed appropriately with the information going wherever it was meant to show up in that particular document. And so now I can sign this electronically, or I can actually draw a signature using the touch screen of my phone or a mouse, and I can submit that. And now it's going to once again secure the file and transmit it back to the server. And so now if I go back to my portal here, I can see that this has moved from my active forms to my complete forms. And I just received a text email letting me know that the form's been completed. And so here in the complete forms, I can download that final document from this secure portal, and I can then load that and save it into the EMR. The customer will have received a copy if the form's enabled to send them one automatically. And we can support tons of integrations here. So, whether or not you want something to be faxed to you instead of going into the secure portal, or whether you'd like it to go via an API or a webhook directly into a system if you have those capabilities to develop that kind of stuff, we can work with you to ensure the information flows as smoothly as possible. And there's tons of uses, obviously, for this, not just for things like a nom-noc, but you can also do this for receiving updated orders, getting a face-to-face document created and sent back. You can use it with assessments to generate reports on evidence of assessments to put into your records. So these really do enable you to sort of eliminate a lot of that friction from paperwork, and ensure that you're delivering your patient services effectively. And that's really important, when you're trying to maintain your cash flow, especially during an emergency situation where you might be strained on some of those resources who'd normally be responsible for overseeing that all that stuff's getting done correctly. Now, Connect and Swift have another benefit as well, which is risk reduction, which is the third point we're going to talk about today. Obviously, ensuring the latest information is always available and utilizing forms that prevent errors from being created in the first place eliminates a ton of potential exposure. But there's another important aspect to operating in emergencies and in general that you should be considering, and that's knowledge validation. PDGM was a great eye-opener, I think, for people because it made people realize that just because someone had necessarily been a therapist for 20 years didn't mean that they could really adapt to new care management approaches or significant shifts in OASIS scoring. And so even though we did a lot of training on that, it's still in some cases been really hard to get that to be fully adopted by the people in the field. And so whether you're looking to validate knowledge on basic things like, how that sort of care management or OASIS or PDGM understanding exists, or whether in an emergency you're trying to really make sure that your employees know how to use PPE correctly or that they actually fully understand the policies that you're putting in place from a work from home perspective, digital knowledge checks can give you that insight. And it's really important that you have a way to gain that insight, particularly when you're dealing with a distributed workforce. And so we call that product, logically, Insight. So we don't have time to go super deep on the Insight product today, but what our system does allow us to do is to build out any kind of knowledge test. We can do that with your team. You can access some of our standard tests that we offer sort of more on an industry basis. And then these are issued directly to your users through the Connect platform. And as people finish these tests, which could be timed or untimed or have any wide range of different types of customizations and randomizations applied to them, the data comes back in real time to your dashboard, which you can then segment. And so you can segment the results by geography or by discipline, or you can even drill down to the individual level. And so here you could see exactly how a specific individual has improved over time. You can go into an exact test, and then within that test, you can see what they got right, what they got wrong, what they skipped because they didn't necessarily know the answer. And this enables your trainers and supervisors to be extremely efficient in filling those knowledge gaps without the need to have these massive broad-in services for all of your staff. Which might not even be possible to get all of your staff together at the same time during an emergency. And so the ability for you to do this targeted training means a much lower cost overall to delivering training, a much higher value delivered from the training because it can be more targeted. And it also allows you to have more staff out there generating revenue for you if they're already competent in that particular area of knowledge. And this leads into the last area that we'll talk about today, which is training. So obviously many of you have access to continuing education systems for your staff, but it's also important that you're thinking about how you're going to adopt your own internal learning management system, or LMS. And ideally, this is integrated with your knowledge checks and resource systems so that as people are going through that training, they have access to support materials. They have access to specifically targeted education on the areas that they may be struggling. And we do offer a solution to that here at ClinicalHQ, which we call Agility. And the reason we call it Agility is because we understand that what we really need with employees today is we need them to be dynamic. We need them to be able to be resilient, to react to situations. And so having that type of training material available to them that can help them with those sorts of specific base knowledge areas related to their job or their field or the industry or to a particular thing like PDGM or COVID. These are all critical areas of knowledge that you want to be able to provide to your employees so that when you do need to hire people in a hurry, or, scale up or do a shift in a major aspect of your business, that's something that can scale with your business, because doing one-on-one training, doing shadow day approaches may not be possible in an emergency situation. It may not be possible if you need to hire a lot of people very quickly. And so you really do need to have an online scalable approach to the training and also that knowledge validation that we talked about to ensure that you are putting out into the field people who can deliver to the quality standards that your organization aspires to. So in summary, there are 4 key areas where technology can help you in the current COVID crisis and beyond, and that's centralized communication, digital workflows, forms and signatures, knowledge validation and risk mitigation, and online onboarding and training. As you can see from today's demonstration, these services are available today. We certainly feel like we're one of the leading providers in the space. There are certainly people out there that do parts of these as well. So if you are interested in some of these services, if you have a need or feel that there's a gap in your current operations, we would be honored to have conversations with you and learn about your specific requirements and see if we can help you to improve your efficiency and quality and to be ready to meet the potential sort of demand that you'll experience if you have to operate again in the future in a pandemic or an emergency scenario. So that's it. Thank you for your time. I'm going to open it up now for Q&A.